So this isn't necessarily an orthopedic test, but these are a few of the observational things that you might like to do with your client to check different areas of the spine or joints, so we can just get a generalised idea of where we might like to do some of our orthopedic testing. So this will be one of the first things I do with my client, so then I'm able to gauge what I need to do next. So I'm going to take you from the top all the way down to the bottom to see the minor little things that you might be able to pick up on as you go through. So let's start with the top. So when you look at your client here, it's best to come and get them to the side onto you. So you want to come through to the side of your client through here. The first thing you want to have a look at is the neck or the head posture. So you want to have a look at whether the neck is actually in a tucked position or whether it's possibly poking out. So just have a look at the position in the neck. You don't necessarily need to do any palpation here, it's just observing at this point as to what is actually occurring through the neck. When you've got them side on as well, what else you can do while you're here is have a look at the humeral head position. So what you might like to do with the humeral head is just come along the clavicle, out to the edge, and just see whether the humeral head is sitting forward or backwards within its socket. If you're finding it's rounding forward and you can actually find the portion of rounding through the humeral head at the front, it's likely that you'll have a humeral head that's sitting forward in its socket. If you're finding that it's quite pushed back into the socket, which is very rare, you'll find that it's more of a posterior humeral head. So have a look there, you might find some rounding or more of a posterior humeral head as well. So just have a look at those as well while you're from the side. The other thing you want to have a look at with your client is get them to turn around and face you. So what you want to do is actually come on from the front. You don't need to do any palpation here again, it's just having a look at shoulder height. So come through and have a look at shoulder height. What's possibly happening through here is one higher than the other. And this is where you might be able to observe some differences that you might want to further investigate through any R1 or possibly shoulder tests as well. From this position, what you might have a look at again is both humeral heads rolling forward, or is it just one? If they've got a shoulder injury, that's probably going to be really important for you as well. Moving further down into the actual spinal region, so get your client to face away from you. This way you can do as a whole all together. Is come and put a finger on either side of the spine. This is actually really helpful if the client is laying face down for you. You can do it a little bit easier without a shirt on, and it will actually show the marks on their spine. However, if you come and put a finger on either side of the spine and run down the spine. So what you're looking for is possible C curves, possible S curves, or possible just one vertebrae deviation as you're coming through. They won't be as significant as that, however you will find a slight deviation as you're coming through and palpate along each vertebrae as you move through here to see that they're all in alignment and that you don't have any curvatures in the spine. So when you're in this position as well, you might also like to have a look at whether they've got hyperkyphosis through the thoracic or a lumbar or excessive lumbar lordosis through the lumbar. So you can either have a look at it from here or you can actually get them to turn onto their side. So if you're looking for a hyperkyphosis through the thoracic, they'll be more rounded and they'll be bent forward through here, and you'll have an excessive curve through the thoracic. If you're looking at a excessive lumbar lordosis, what you're likely to see is that the lumbar spine curves more anterior, and likely with that you'll also get an anterior tilt of the pelvis, but you're going to get more of a curvature through the lower back here. These will just give you an indication of what's possibly happening above and below those regions, and what may be contributing to their peripheral pain or even their spine pain as well, which they may be experiencing. Coming back to the back, what you might like to do when you're here is have a look at scapular heights. So there are two portions which are really important to check in the scapulars. One is the spinal scap. So find spinal scap, it usually lines up around T3. Find both of your spinal scaps on either side. Come onto the edge of the medial border of the scapula. Stand directly behind your client and just see whether they're equal, whether one's higher than the other, one is more retracted or protracted than the other, and just give you a little bit of an idea of the scapular biomechanics which may be occurring. The other thing which you might want to look at here is the inferior border of scapula. So if I find the inferior border of scapula, usually sits around T7, however it really just depends on the size of the scapula and also the person. So find the inferior border of scapula, and again, come straight behind your client and just see whether one is higher or lower, and whether one is possibly winged or flicked compared to the other as well. So that's what you may like to have a look at through your scapular region as well. From here, the other thing which you might want to have a look at as we move down through the back is the PSIS heights. So find your PSIS through the back. If you're struggling to find PSIS through the back, get your client the lumbar flex and it will make them more predominant through the back for you. And you should be able to find them fairly easily at that point. Make sure you come down to eye height with the PSIs, so you're able to line them up nice and equally, and just see whether one is more anterior, posterior, whether you may have one sitting a little bit higher than the other as well with the PSIs height. From here, you can, once you assess the back of the pelvis, come through and assess through the side. So when you're at the side, what you might like to do here is assess whether we've got an anterior or a posterior tilt through the pelvis as well. So again, you'll need to find the PSIS through the back. This is best if you actually crouch down with your client, and you'll need to find the ASIS at the front. So what you want to do at this point is where it's as if you're drawing an imaginary line between both of your fingers. So we want to have a 5 degrees tilt in that anterior position, so forward. So if your fingers are equal, the client is likely having a posterior tilt. If your back hand is lower, the client definitely has a posterior tilt. And if you have more of a 5-degree tilt forward and your front hand is quite low, it's likely the client has an anterior tilt of the pelvis as well. So it just gives you an indication of what's possibly happening in the lower back as well. From here, get your client to turn around and face you. You can come and assess ASIS heights if you like. If you've done PSIS and also your anterior posterior tilt, it gives you a pretty good indication of what's probably happening during the ASIS as well. From here, you might like to come and have a look at knee heights, or even how the client is standing. If you find your client by this point is just getting awkward at you watching them, just get them to march on the spot, and this will just make sure that the client's feet are actually in a normal position for you as well. So what you want to do here is come and have a look at the superior patella height. So come through and find the top of your patella, put your fingers on both, sit nicely in between, and see where the patella height is. You can then also do the inferior portion of the patella to see what it is doing, and you may be able to pick up whether they're tracking or sitting more laterally or medially in that position as well. From here, also have a look at the feet. So you can come onto the malleolus on the medial or the lateral side. Again, put your finger on either side, so have your one or thumb on the medial malleolus and your finger on the lateral. Come down really close to the height of their ankles, and we should see about an equal portion between the medial and lateral malleoluses rather than one rolling inwards or outwards. The other thing we can look at here as well is supination or pronation. So we just can have a look at whether the arches are falling in or actually rolling back out to give us an indication of what's happening in the feet, which may be leading up to knee and also hip pain as well. So this should give you a pretty good indication the whole way through from the neck to the feet at what's possibly happening in the spine and also peripheries for you.